Hi, my name is Lauren Hutzel. I'm going to be doing my mom assessment. Um, so I would knock on the door, do WIPA, I'd wash my hands, I would introduce myself, provide privacy if needed, explain the procedure, identity, what's your name and date of birth, okay, and any allergies. All right, that's good. All right, so what I'm going to do, I'm going to just do an assessment since after your birth, make sure everything went okay. So I'm going to get at a personal level with her, make her feel comfortable, maybe sit down. So I'm going to ask about the labor. So how did your labor go? Was there any sudden complications or unexpected things that happened? She states it went pretty well. Nothing too bad went on unexpectedly or anything. I'd ask about her pain, if she rated it, 0 being the least, 10 being the worst. If it's manageable, if it's not, what we can do. I would ask her baby's name, and she would state that she told me the name, so that's good. She didn't refer it to it, so that's good. She's not showing signs of detachment from the baby or anything. So I would ask about breastfeeding, and she states that she is breastfeeding. She states that there are no engorgement, which I tell her that's a normal finding, 72 to 96 hours. You shouldn't have engorgement. I say, ask about nipples. She says there are no cracks on it. There's no pain. The baby latches on very good, so that's good. Okay, so I'm going to ask about last time she voided or about bowel movement. So she states the bowel movement a little bit right before the delivery, hasn't had one since. I'd say that's normal for up to 2 days, so that's fine. Voided right before I came in the room, stated that there was no odor to it. There was a little bit of light bleeding, red blood, that is fine, and a little bit of clots. If they're small, I told her that is a normal finding at first. Okay. So I'm going to go ahead and do the assessment if that's okay with you. She said that is fine. So I'm going to check the breast. Like she stated, there are no cracks. It is right. No engorgement, which is the normal finding. Baby did latch on good. We looked at it. I'm going to go to the abdomen now. Make sure it's symmetrical. It looks good. Doesn't look like any lesions or anything's going on. I'm going to listen to some bowel sounds. I'm going to listen from the right lower to right upper to left lower. All right, the bowel sounds heard in all 4 quadrants. I'm going to put some gloves up now because the lower I get, the more chance there is a little bit of bleeding down there. So just want to be sure with that. I'm going to put her in 30 degrees at least, and her legs up and back, out and back. So I'm going to palpate the abdomen. It seems fine. Palpating the bladder, I should not be able to find it, especially because she just voided, and I don't find it, so that's good. I'm going to cup the fundus and feel for the uterus, and it's not boggy, it's firm. That is normal. I'm going to push a little bit just to see if some blood clots came out. Okay, I'm going to check her pad for bleeding. There's only a little. She changed it when she voided last, she stated, so it's just a little bit of bleeding. It's fine. Maybe a little bit of clots. It's okay. And there was no odor to it. While I'm down here, if she did have a C-section, she didn't, but if it was a mom that had a C-section, I could check the C-section site for infection. So redness, swelling, the drainage, if any, all that, heat. So I'm gonna check the back now. I'm gonna check the epidural site because that was invasion of her skin. Make sure that there is no signs of infection there, no redness, swelling, drainage. She looks good. I'm going to check now the rectum from hemorrhage or hematoma. Don't see any, so that's okay. If there was a hemorrhoid, there can be a sitz bath. So we could tell her that if there was one that was found. I'm gonna come down now, put her pad back on, make sure she's checked the legs, looking for just redness, swelling. It looks good. There's no edema, no superficial clots. If there were the superficial ones, you could do warm compress. I'm gonna check for DVTs. If she had a DVT, it'd be a bigger inflammation, swelling in the leg. It would be warm to the touch, and most likely she'd have pain. I'm gonna check the dorsalis pedis. Those are +2, regular, good. I'm gonna check the clonus, so I'm gonna rotate the foot and then snap, and there should be no jerking. That's the normal finding. With my pillow, it's kind of hard. Looks good. Alright, I think everything looks good. I'd provide education if any was needed for safety. Make sure baby is in reach. She has everything she needs. Call lights in reach. Bed lowest position. Hand hygiene, and I would exit the room.